I am Muhammad Al-Ni'ma Arbab Tom from Sudan. Actually, we are coming here to treatment my mother cases. Since 10 years, my mother, she have damage in left foot. We are facing an interview more doctor in Sudan. In Sudan, they said no treatment can done for this food, and we are coming here in India, Delhi. We interviewed many doctors also, said also no can did treatment for her leg, left leg. They do just blocking or for blocking pain. And we start discussing with Fortis doctor team. Firstly, I will thank all team who did this treatment, and we do very pleasure for us this time. Dr. Sonal, Dr. Puneet, all staff. This is very respected staff, very nice nurses, carefully investigation. We are very happy now, and really I don't have any word to say. Thank for Fortis doctor teams who did this treatment. My mother since 10 years not walking, sitting. Now my mother good, alhamdulillah, and she walking now. Better, and she feeling good for deep and full pain as before. Now treatment finished. We are completed 15 days here in India. Tomorrow, inshallah, we go back our country. Thank you, Fortis Shalimar Bagh, and all staff. All staff, I will say thank you so much, a lot of Dr. Puneet, Dr. Sonal. This is very nice doctor I facing in my life, really. And we are facing good nurses in admission also. This is what I need to say. Thank you. Thank you. This is my mother. This is my sister also with me. We are coming here. We are now alhamdulillah, is very, very pleasure for this treatment. Thank you so much. Thank you.
I am Dr. Sonal, Director and Head Neurosurgery, Fortis Hospital, Shalimar Bagh. It's an extreme pleasure to share our experience with this patient from Sudan. As he has mentioned, his mother was for last 10 years after a crush injury, had excruciating foot pain and couldn't walk at all, even had sleepless nights and was in a terrible pain. As he correctly said, in Sudan, they told that there is no treatment available, and when he took few opinions from India, there were various options available, and she was in so much of pain that in fact the family was ready for one opinion which was given to them, that we will do the surgery in the back to desensitize the sensory nerves for the whole leg. Whereas me and Dr. Puneet, who is our Senior Orthopedic Associate Director at Fortis Hospital, Shalimar Bagh, we discussed the case in detail, and we realized that we need not do anything for the whole leg. Why don't we address the foot itself? On MRI, it showed a tumor, and we thought it was either arising from the nerve or was arising from the layer around the bone. And we did this surgery after giving a guarded prognosis, because the disease was there for 10 years. So you cannot actually give false promises to the patient that the pain will definitely go. But since there was a tumor, we felt that that was the first line of treatment that should be given to the patient. Patient underwent a successful surgery by the team, and very, very fortunately, patient is relieved of her pain, and the stitches have been removed today, and his son and family and patient are so happy, as well we are, that patient is being able to walk now. She came wheelchair bound and she is walking now. What a better experience than that as a doctor. And on histopathology, it did not turn out to be a tumor arising from the nerve. It turned out to be a tumor arising from the layer around the bone, and the subject matter expert for the same is Dr. Puneet. So I'll hand it over to Dr. Puneet to say a few words about his experience and about the disease, about which he has actually prognosticated to the family that how the disease can behave in future, not only addressing the present problem. What is important for us is that they stay in follow up with us and she can have a comfortable life. Thank you.
Good morning everyone. I am Dr. Puneet Mishra. I am Additional Director at Fortis Hospital, Shalimar Bagh. Just wanted to share a very good experience with this patient who was suffering from chronic foot pain for the last 10 years. She was worked up in her country, as Dr. Sonal told you previously, but to no outcome. And various opinions were given to her, starting from the spine surgery to biopsy for the foot and whatnot. And this did not lead the patient anywhere. So when we examined the patient as a team, we concluded that her source of pain was a problem in the left foot, and which needs to be addressed rather than anything to be done for the spine or for desensitizing the left lower limb. So we also prognosticated the patient that this could be either a neurogenic tumor, as it was opined in previous biopsy and previous scans, or it could be something arising from the layers around the joints of the foot, which is the synovium. So with these probabilities in mind, and after a thorough preoperative workup in form of CT scan and MRI, we took the patient to the OR, and as per our plan, we operated upon her and we removed the tumor which was arising from the layers of the joint capsule. And it was an extensive tumor covering almost the whole of the forefoot, involving the small joints of the foot. After the surgery, the patient recovered well, and to our surprise and our satisfaction, the pain disappeared and the patient started walking immediately after surgery with help of a plaster support, and she had not walked for the last 10 years. So as the patient's family was satisfied, and so were we, that this patient had ultimately started to walk and had experienced relief in pain. And as the biopsy turned out to be a synovial chondromatosis of the foot, which is a very rare condition, as the most common joints which are involved in this condition is the hip followed by the shoulder, and the foot is very rarely affected. So we also took the opinion of the radio-oncologist in our hospital, so that because this condition is notorious for a recurrence, and this was explained to the patient's family that sometimes this condition can recur in almost 1/3 of the cases, and if there is recurrence, that she might need a future revision surgery, and after that surgery she will be a candidate for radiotherapy also. But in primary operations, radiotherapy is avoided, as there are only very few case reports supporting radiotherapy as a treatment. So now patient has been prognosticated well, stitches have been removed, she has recovered well and is walking without support of a walker or a stick at her home. So with these advice and with a constant follow-up every 6 months or so, the patient has been advised to keep in touch with the primary team, and subsequently we will see how the patient behaves.